Hello, I'm Vaibhavi Patel. I'm physical therapist over here. I am going to start cranial nerve assessment for you. Okay, can you tell me what is your name and your date of birth? Right, then patient will tell me a name and date of birth, and then we will start cranial nerve assessment. First, we will start with cranial nerve 1. For the cranial nerve 1, you have to close one nostril. You have to close one nostril and close your eyes, and then I'll put a cup. Okay, and then you will tell me what is the structure, what is the familiar structure that is you are smelling over there. Okay, so close your eyes and then close your nostril, and then smell and let me know what is this, and then patient will tell me that it is coffee or soap, whatever is there in the glass, in the cup, and then we'll repeat the same thing on the opposite side. That is for cranial nerve 1. Now for cranial nerve 2, first we are going to see the visual acuity. For the visual acuity, we'll ask the patient to read from the Snell's chart. Okay, if the patient has glasses, then we will tell patient to put the glasses on. If the patient does not have glasses, then we will ask the patient in both of the case to close one eye. Okay, shut one eye down, and then read the line that patient can read from the Snell's chart. The Snell's chart is there at the 30 meters of the distance, and at the 30 meter of distance, we will ask the patient what is the letters that he or she can read, and then he'll tell me that, like, I can read over here LEFODPCT, which is the lowest line, and then we can say that the patient has acuity of 20 by 20. Okay, that is the normal acuity, and if the patient can read whatever legible line, then we can tell what is the patient's score, which is mentioned over there. The next thing that we are going to assess is patient's peripheral vision or visual field. For visual field, we will ask the patient to close one eye, and then we'll ask the patient to concentrate on the therapist's nose. So I will ask the patient to close one eye and focus on my nose, and then from each quadrant, upper right, upper left, lower right and lower left, I will wiggle my finger, and I'll ask the patient that when tell me when he or she can see the finger. Okay, okay, now from the other side. Okay, and then from the lower quadrant too. Okay, and then I will cover my other eye, and then we'll do the same process for the other side. Okay, we'll check the 4 quadrants, upper and lower. Okay, and patient will tell me whenever my wiggling finger is visible to him or her. Okay, that is for visual acuity and peripheral vision. Now for combination of optic nerve and oculomotor nerve, we are going to check the reflexes. Okay, so for that I will shine the flashlight in your eye. Okay, and then just focus far away on the wall or on the curtain in front of you. Okay, so the patient will be in the sitting position, and then I will flash the light. Okay, and then put it back down. Okay, I will do it from the distance, and then I can see pupillary constriction over there on the same eye, that is direct pupillary reflex, and constriction on the opposite eye for indirect reflex, and then I will do the same thing in the opposite eye. Constriction from the same pupil will be for direct reflex, and on the opposite side, that is indirect reflex. And then I'll ask the patient to concentrate on my finger, and then I will let my finger go closer to the patient. So if I'm the patient, then this is my finger, and then I will ask the patient to concentrate on the tip of the finger, and I will see the convergence of the eyeballs, that is the accommodation reflex that I am seeing over here. The next one is the oculomotor, trochlear and abducent nerve, that is 3, 4 and 6. For that, we will do the edge test one by one in the each eye. So I will ask the patient to trace my finger. So we'll start with the center, then we'll go on the side, then up, then down, then again up, then to the center, then to the side, lower, center, up, and again back to the center. So we'll do the edge letter test for the both eye the patient will follow with follow my finger for the each eyeball, right and left. There is 3 4 6. Okay, for the oculomotor 3, we have to also check the ptosis of the eyelid and also for the pupillary sizes, that pupillary sizes are equal on both sides or not. Then we will go for the trigeminal nerve. For the trigeminal nerve, will check the sensory part. We'll check the sensations at the We'll check the sensations at the forehead, then at the cheek, and then at the jaw. I will ask the patient to close the eye, and I will put the points over there and touch with the gauze or cotton, and then patient will tell me that patient is feeling bilaterally symmetrical sensations over there or not. So patient will tell me that it is same and same over here. Then I will ask the patient to open the mouth, and I will give resistance over here. Okay, and then I will ask the patient to clench the teeth, and we can palpate over here. The next one is facial nerve. So for the facial nerve, I will ask the patient to raise the eyebrows, then shut the eyes, puff the cheeks, and smile to check the facial sensation. And then we'll ask the patient if there is any taste sensation that patient is not feeling over there, that is for the sensory part of the facial nerve. Then for the vestibulocochlear 8 nerve, cranial nerve 8, we'll ask the patient to sit over there, close the eye, and I'll ask patient that patient can feel my rubbing of the finger bilaterally equal or not. Then I will ask the patient for any symptoms of dizziness, vertigo, or I will ask for any nystagmus in the eye, which I can see while I am testing the oculomotor nerve. So it will say the oculomotor nerve is intact or not. The next one is the whisper test that we can do for cochlear part of the vestibulocochlear nerve. So I will just 2 feet away, I will whisper a number like 7874 kind of a series in the patient's ear, and then patient will tell me what patient hears. And now cranial nerve 9. So for cranial nerve 9 and 10 combined, we will ask the patient to swallow or gulp a sip of water. Then I'll ask the patient to say ah, and when patient will say ah, I will see the uvula and soft palate. Okay, and if I want to trigger the gag reflex, then I will use the tongue depressor, and I will ask the patient to open the mouth, and I will gently stimulate the tonsils, pillar of tonsils, and I will see the response. If the palate is symmetrically elevated and uvula is in the center, then 8 and 9 are intact. And for the 11, I will ask the patient to for the spinal accessory nerve, I will ask the patient to shrug the shoulder, and I will resist it downwards, and then rotation of the head, and I will resist in the side. If patient is able to do that, then the 11th is intact. And for the 12th, I'll ask the patient to protrude the tongue, and then I will check for any fasciculation and the shape of the tongue, and then I will ask the patient to take it sideways like this. Okay, and then I will ask the patient to resist it, take the tongue on the side of the cheek, and I will resist this side of the cheek like this. If it is possible, then 12th cranial nerve is intact. And this completes the cranial nerve assessment. Thank you.